Hi everyone, it's Heidi here from the Nest Kids CPR and Allergy. I hope you're well today. Today we're going to talk about eczema and most importantly eczema in young children, because it is a big topic and it's a very common topic as well. So eczema, you might have heard it called atopic dermatitis, which is another name for it. And it's most common in babies, and in fact 1 in 5 children under the age of 2 suffer with eczema from all varying degrees. Some might just get a little bit behind the knees or in the elbows, and others might have eczema flares, quite severe. So it can obviously also occur in older children and adults, but usually it improves with age. Obviously, like anything, that's not every time, but it does often improve with age. So although eczema can be effectively treated, there is no cure. So it's very similar to asthma and allergies in the way that they can be treated and managed, but it's maybe no surprise that the 3 of those things come hand in hand, like eczema, asthma, and food allergies. So I've got some notes here because I don't want to forget to tell you anything. So we don't really know why people develop eczema. It's not that well understood. But it is common for, like I said, for people with eczema to have other disease as well. So the skin on people with eczema is different to the skin of people that don't have eczema. So basically there's a barrier, a skin barrier that just doesn't work very well at retaining water. So the moisture is easily lost, and that's where the eczema occurs. So drinking more water and things like that, unfortunately, is not really going to help with eczema. So the symptoms can be that there's usually like a red, itchy rash, often on babies, it can start on the face. But yeah, a red, itchy rash, where sometimes the skin can ooze, and it becomes quite rough and hard. Over time, it can become quite rough and hard. When it starts to ooze, this is a worry that it doesn't get infected, because infected eczema it spreads very quickly, so it often needs quite quick treatment. And when it does get really red, that's what they call an eczema flare. Eczema can often flare if your child has existing food allergies as well. When you feed them something new, sometimes there can be a little bit of an eczema flare, but as long as it's relatively mild, that's sometimes quite normal, and it will go away over time. Infantile eczema often starts before the age of 6 months, and the symptoms are exactly the same as described above. It can be anywhere on the body, but often on the face for an infant, but usually significantly improves by the age of 2 to 5 year olds. Childhood eczema it can go on, or it can develop between the age of 2 and 4, and that's where you often see the creases behind the knees, the elbows, and those kind of classic symptoms there, face, neck, behind the ears. So that's more where childhood eczema can erupt rather than infantile eczema. So like I said before, eczema and other allergic disorders, many children who have eczema will have dust mite allergy, food allergies, and if there's a family history of food allergies in a child that has eczema, then there's up to 4 in 10 develop asthma or hay fever as well. So if a child has eczema and there's a family history of allergy, then they're four times more. There's 4 in 10 develop asthma or hay fever. Okay, so and 3 in 10 infants will develop eczema. So it's really common. Things like eczema, food allergy, and asthma now are the most common prevalent things in childhood that we're having to deal with. Many babies who have moderate to severe eczema do develop food allergies, and this may be because when the skin barrier is damaged, babies can become sensitized through their skin to a food. So if they get a certain food on their skin, or they're touched relatively often with a certain food, or they have a cream applied that is a food-based cream, that can sensitize their body to a certain food, which then creates these IgE antibodies that cling on and wait for the next exposure to erupt into an allergic reaction. I'm not going to go into any more detail than that, because I talk about this in other things that's more allergy, but babies can become sensitized through their skin. So children with eczema are more likely to become sensitized through their skin because the skin is broken and it's like a direct route into the bloodstream. Okay, so we need to be careful of this. For this reason, this is why we need to introduce foods early to children with eczema. I'll introduce allergenic foods. Like as soon as your child starts eating, they need to have those allergenic foods. And with severe eczema, sometimes removal of certain foods from the diet can help the eczema, but it should only ever be done under medical supervision or the supervision of an experienced dietitian or someone who knows that field. Because I know there is a lot of cutting out foods in children with eczema without medical supervision. And I just want you to be really careful, because when you take a food out of a child's diet or out of your diet when you're breastfeeding, and that child is not getting that early exposure to that food, say milk, egg, nuts, anything like that, sometimes then if that food is then introduced later on, there's more chance that that child could be allergic to that food because the immune system's not used to it. We know early introduction of these common allergenic foods reduces the rate of childhood allergy. So late introduction, you end up with a higher rate. So be careful cutting out foods. I'm not saying it's the wrong thing to do, because often it is the right thing to do under medical supervision to stop, eczema symptoms, but just make sure you're doing it under supervision, that's all. So what can trigger eczema? There's loads of things that can trigger eczema. So when the skin barrier is damaged, the water evaporates, so the skin becomes more susceptible to allergens and irritants, and obviously can get infections and all sorts of things. And that can cause the release of the itch chemical. And the more the child itches, the more the chemical is released. So then the scratch itch cycle just becomes awful. So some common triggers are scratching of the skin, which makes it worse, then dry skin, infections, swimming in chlorine sometimes, playing in sand. And this is all they might be some triggers, won't necessarily be what triggers your child. Sitting on carpets or grass because of maybe dust mite or pollens. Food intolerances, sometimes perfumes, sometimes a sudden temperature change, and also stress. So that doesn't mean eczema is not a psychological condition, but we know stress can cause physical issues. So there we go. That's a rundown on eczema, especially eczema in young children. If you want more from The Nest, then hop on over to the website at www.thenestcpr.com. And you'll find a couple of things over there. We've got the free first aid pocketbook, which is at the bottom of every page on our website, and you can grab that for free today. And that has some first aid, CPR, choking, lots of things in it that for an emergency situation. And then also, if you are a family that has a child with food allergies, the Nest Allergy membership is open right now. We have some fantastic bonuses expiring on Friday, including a free class, pass to a free class, basically an allergy specialist in your pocket 24/7. We have loads of free resources. We have weekly calls, all with registered allergy nurses. Next month, we have an immunologist coming on to speak to us and answer all your questions. So come on over and have a look at the Nest membership. So that's the nestcpr.com/membership, and take a look and see if that could suit. Otherwise, keep in touch with us and drop your comments below. Follow us on Instagram and send us a message. Say hello. Okay, take care. Bye-bye.